In the early days of my PR career, I made the terrible mistake of losing track of my professor. I'd negotiated an exclusive story in the Fairfax media about the launch of a new respiratory medicine, and it was featured on page 3, and I sat there quite happily reading the story, feeling pretty proud of myself. I remember it being a Saturday morning and my phone rang, and it was a senior journalist at Channel 9 who decided he wanted to turn my newspaper story into a TV piece for that evening. But that was going to be very difficult for me because I didn't really know where my professor was, the respiratory specialist who was featured in the print story. So after talking to voicemail messages and trying to track him down somewhere, I rang the journalist back and explained that the TV news story just couldn't possibly go ahead. The response of the Channel 9 journalist was uncompromising. He said to me, "Martin, this story is an ocean liner. It's unstoppable and it's going to land at 6 p.m. on tonight's news. So you better find me a specialist who can talk to the study and explain to my viewers why this new launch is so important." So, very difficult time. The only person that I could find with any credibility was the medical director at the manufacturer, who it so happened was also a co-author on the study. And Channel 9 actually went for it, which surprised me at the time because in those days really no one from the mainstream media spoke to medical directors from manufacturers. But he really bailed me out. In fact, that day he was my saviour. But it got me thinking about how much things have changed now, and it's quite common for us to see medical directors on TV, especially during the wall-to-wall coverage of what's happening with COVID-19. We see medical directors and senior pharma executives talking about best ways to prevent and treat COVID-19, so it really has turned around. So much, in fact, that being a really good storyteller via the media has now become part of the job description for medical directors. I think being able to tell a compelling story about the benefits of certain medicines and how they impact patients and the research and development programs that go on behind medicines is a really important skill for medical directors and pharmaceutical executives. The Palin communications team has been fortunate enough to work with some really talented communicators in the medical sphere. So people like Melinda Munns at BMS and Andrew Weeks at GSK understand very well the importance of being able to communicate in consumer language what is going on from a research and medical perspective in those companies. But there are still those out there who are reluctant to get involved in public discussions, perhaps a bit shy about promoting themselves via social media or mainstream media. But I just feel with those requests from the media and from other sources being much more predictable in the future, we can probably all see that one coming. So it might be time to write it into the job description and get prepared for the next opportunity.